Good day, everyone. This is Walt Fritz from Foundation Seminars. I just wanted to touch base with you for a few minutes here. Over the last couple of seminars, I've introduced kind of a neat brain exercise for a lot of therapists. The therapists who attend my classes often are speech pathologists who may have limited or no previous manual therapy experience, but I also get a fair amount of massage therapists, physical therapists, OTs, and other professionals who have moderate to complete manual therapy experience. But what I have enjoyed doing lately is start with an introduction where I just ask the therapist to grab hold of themselves, so to speak, whether it's here in the face or in the neck, someplace easy to grab hold of, and just stretch. It's a safe enough word to say is when I do this, I'm stretching. But then I ask them what they're stretching. You know, if you follow me for a while, you know that I try to explain things from a simple perspective, that we acknowledge we're stretching our skin. Skin may have enough receptors, etc., or ways to communicate with the brain and ways to reduce tone and tension to facilitate the changes we see in manual therapy and voice and swallow and all the other things. But it's interesting when people do this and they touch themselves and they stretch and their brain immediately goes to the rabbit hole from which they were trained. I know in my experience and my training, I was taught that when I do this or this, that I'm stretching or releasing someone's fascia. But another therapist might do almost nearly identical thing and have visions of possibly releasing muscle tension or reducing muscle tension or facilitating muscle action or reducing lymph pooling or cranial lesions or all sorts of issues. And people often automatically go to a certain tissue, a certain pathology, or things that I call metaphoric pathologies, of which, fortunately or unfortunately, depending on how you're trained, fascia restrictions are such a metaphoric pathology. So when I teach this work and when I do this work, I try to keep it simple. Instead of pointing to a tissue or a structure or pathology, or heaven forbid, metaphoric pathologies, we talk instead about the inclusion of a patient into that process. And when I do something like this to you, a patient, what do you feel, right? Do you feel a connection to your issue, your problem, your difficulty, or even your pain? And when I do this, does it feel helpful or potentially helpful, or is there anything about it that feels like it might be harmful or totally useless? And I guide my intervention strategies based more on the patient's perception of how that touch feels versus my ego. And I think my ego is strongly involved when I start teaching my patients, or teaching air quotes my patients, about the pathology that's wrong with them or the tissue that's at fault, or heaven forbid, the fascia that's tight. So if you're interested in this kind of approach, come visit me sometime at one of my seminars. You can find information about the seminars at foundationsandmfr.com. Bye.